My name is David A. Rutolo, and basically I'm a chemist. My undergraduate work was in biology. I went to graduate school in organic chemistry and then did doctorate work in synthetic organic chemistry, where I actually made molecules of different types, principally pharmaceuticals. And then for about 35 years I actually did mostly development in nutritional products, using again some special technology. And that's principally what I did, and have done that for pretty much my whole life, trying to use science and technology for helping in the area of nutrition. Very early on I started to look at what I call nutritional delivery systems. That is, ways to make a nutrient more available, more usable, more efficient, and to minimize interactions, to block as much of binding and waste and loss as possible. A lot of nutrients aren't absorbed well anyway. I mean, calcium, maybe, you get 20-30%. Same with vitamin E, 20-30% would be tremendous. But, if you make systems that are more compatible, like, say, a micellar system with E, you can enhance that absorption significantly. So the whole concept was trying to take technology that was actually used in medical science to improve the absorption, uptake, utilization, etc. of these pharmaceuticals. I thought, well, why couldn't you do that with nutrients? Because people eat different. Sometimes you have a bad digestive system. Sometimes you're under stress. Sometimes, who knows what you're eating. And so, well, how can we minimize all those side effects that might affect nutrients the same way they do with pharmaceutical drugs? I mean, sometimes you can't take something with food or another type of food, but for the most part, pharmaceuticals were always pretty effective at getting in. And of course, they do extensive studies. So I thought, why couldn't you use that technology with nutrients? I mean, you don't just, of course, when you eat foods, you're taking them in, but the body does a whole lot of processing. So why not try to mimic as much of that as you can to get the best possible delivery? And that was my whole thinking, is that I mean, I always thought nutrition was very important, but I always thought you could use some science with it too. Well, the process of micellizing or micellization is actually a natural process that does occur in the body. And as I mentioned, the body actually takes fat-soluble nutrients as large amounts of fat globules and acts on them in such a way that it breaks them up. And it's a natural process that occurs. Micellization is not a technical term that was created. It actually is the process by which the body converts the fat into a micelle, which is really a tiny particle of fat surrounded by water that makes it so small that it actually can pass through the intestinal tract. So the process of micellizing is a natural process that occurs in the body. So if you're making a product, if you can mimic that or somehow duplicate what the body does by taking that first and taking the fat and making the particle size small, you're really doing what the body does, but that way you have a much more efficient mechanism of bringing nutrients in, particularly the fat-soluble nutrients, and they're becoming more and more important because you realize a lot of the antioxidants are also fat-soluble. So in biomedics, there's an effort now to use some of the new technology. The biocellular micellization process basically is taking a variety of the nutrients all together at one time, using food-approved materials and making a micellar system out of all of them at once, so that you have greater absorption than you would in the oil form or a powder form. And that's what we've done. For the average person who really isn't, say, an expert in science or nutrition, and you really don't know much about anything, I think what you have to do is ask yourself, you want to feel better, you want to look better, you want to have better appearing skin, you want to have more energy, you want to be, more available to go out and have fun and enjoy yourself. All of that's dependent on whether or not you have a really healthy body too. If you're not particularly healthy and you feel run down, you feel tired, you're not going to be either enjoying yourself or working to your peak performance. So, if you have kids, you're not going to be as active with them. They got plenty of energy and you don't. You have pains and creaks and all those things. A lot of these things really are a result of not really taking care of your body. So the interest should be not that I want to take 500 pills like some sort of these health food nut people used to do. That's not the objective. The objective is to try and take in the nutrients necessary to let your body perform as best as it can.